Since coming into office, this government has made big strides in fixing our broken NHS. Under the Conservatives, the NHS suffered years of industrial action, costing taxpayers billions and costing patients more than 1 million cancelled operations and appointments. We negotiated an end to the resident doctors' strike within 3 weeks. We have delivered the 2 million extra appointments we promised in our first year, and we did it 7 months early. And after 14 years of rising waiting lists under the Conservatives, we are finally turning the tide. But there should be no doubt about the scale of the challenge ahead. We inherited an NHS going through the worst crisis in its history, so there is no time to waste. We inherited public finances with a £22 billion black hole, so there is no money to waste. Lord Darcy's independent investigation into the National Health Service traced the current crisis back to the 2012 top-down reorganisation of the NHS by the Right Honourable Lord Lansley. The Health and Social Care Act established more than 300 new NHS organisations, created a complex and fragmented web of bureaucracy, and, to quote the Darcy investigation, imprisoned more than 1 million NHS staff in a broken system. Well, today, Madam Deputy Speaker, we are putting the final nail in the coffin of the Conservatives' disastrous top-down reorganisation of the NHS. There are more than twice as many staff working in NHS England and the Department of Health and Social Care today than there were in 2010. Twice as many staff as when the NHS delivered the shortest waiting times and the highest patient satisfaction in history. Today, the NHS delivers worse care for patients, but is more expensive than ever before. In the Hewitt Review, the former Health Secretary, my right honourable friend Dame Patricia Hewitt, reported that one local service was required to send 250 reports and forms to NHS England and the Department of Health and Social Care in a single month. That is time and energy that is not being spent delivering care for patients. The Hewitt Review also concluded that having two organisations doing the same jobs has led to, and I quote, tensions, wasted time and needless frictional costs. Since coming into office, I have sought to correct that by building a one-team approach between my department and NHS England, working towards our shared mission of building an NHS fit for the future. Today, the Prime Minister is announcing that we are turning one team into one organisation. Work has already begun to strip out the duplication between the two organisations and bring many of NHS England's functions into the department. NHS England will have a much clearer focus over this transformation period. It will be in charge of holding local providers to account for the outcomes that really matter, cutting waiting times and managing their finances responsibly. The government is proving that only Labour can be trusted to reform the state. The Prime Minister has committed to cutting the number of quangos. Today, we are abolishing the biggest quango in the world. The reform the Prime Minister is setting out today will mean fewer checkers and more doers. It will cut through the complex web of bureaucracy and devolve more resources and responsibility to the front line to deliver better value for taxpayers' money and a better service for patients. And it will set the NHS up to deliver on the 3 big shifts needed to make the service fit for the future, from hospital to community, analogue to digital, and sickness to prevention. Madam Deputy Speaker, the NHS is broken, but it is not beaten. Together we will turn it around, and I commend this statement to the House.